I'm Venus Smith. I am happy to be with you today and very grateful for the opportunity to present my master's capstone project. My project is aimed at targeting med-surg nurses and convincing them to pursue nursing certification. Hearing that, you might be thinking, this doesn't apply to me because 1, you're already certified, and or 2, you're not a med-surg nurse. I will ask that you put that aside for 10 minutes or so and listen and relate what you're hearing to your own area of specialization. As I said, I'm a master's in nursing education candidate at Western Governors University, and I'm soon to finish. I have my ADN from Alvin Community College and a BSN from UT Arlington. Been a nurse since 2005, but I've only been certified since 2015. I joined here at Methodist about a year ago. I work on 7 East. And after today, if you have any questions, I welcome you to email me. My address is really easy to remember. It's V, my first initial, Smith at Houston Methodist. Since I'm an education major, my presentation would be incomplete without some learning objectives. Here's what we want to cover today. I want you to be able to understand the benefits of nursing certification, maybe beyond what you already knew. I want you to be able to recognize and appreciate the barriers that you have faced and that your coworkers currently face. And 3, let's learn some strategies that can help a nurse come through to certification. Lifelong learning drives us. Lifelong learning is an acquisition over a lifetime of knowledge, skills, and understanding. It's good stuff. This is where we learn and we apply what we learn to possibly change our practice. However, stakes are not always high with lifelong learning. This includes pleasure learning, and engaging in it makes you a pleasure to be around. There's a however. In healthcare, basic knowledge is an entry ticket, but failure to continue to learn leads to incompetence. Here's another definition for you. Continuing competence is an ongoing commitment to practice safely, effectively, and ethically. It does take maintenance. Knowledge is not static. The stakes are high. This may seem like this is more relevant for nurses been around for a while, but State Board of Nursing in Texas tells us that it applies to all of us if you hold a license. They want us to prove our continuing competence, and we do that every 2 years by 20 CEUs, holding a nursing certification, or 3 being in school. This slide is about showing these newbie med-surg nurses that what they're doing for the state board is really all they need to do to get started with the med-surg nursing boards. There's no extra work involved. They've already got the hours covered. So we've already established that it's a good idea to be certified because it's efficient, it's taking care of your licensure requirement. However, let's talk about some benefits aside from that. Intrinsic benefits are felt within the nurse, things like autonomy, empowerment, validation, job satisfaction, career satisfaction. And then we have extrinsic benefits which come from outside and they flow to the nurse. I'm of the opinion that when the nurse is certified, feeling empowered, working autonomously, that the extrinsic benefits flow to the nurse. These are things like job advancement, recognition, appreciation, and credit on our clinical ladders, which may lead to some financial improvements or salary adjustments, and reimbursement too. We are doing some hard work getting certified, and our employer supports us in it. So they do this because there are some benefits to them. Benefits that are real easy to name off would be employee satisfaction. The employee satisfaction leads to retention. Certified nurses stay in the workforce longer, and that is of hugely cost-saving importance to the hospitals. There's also quality or patient safety, which I'll talk about in a moment, and then we've got magnet recognition. We're up for renewal in the next year. We know that the magnet people are really interested in our rates, and believe me, you're being accounted for in terms of our organizational goals. Patient safety, I told you we'd talk about that here in a little bit. So I want to point out that patient safety has ties to nursing certification. Among patients cared for by certified nurses, we have lower CLABSI rates, lower fall rates, lower ventilated associated pneumonia. And then we've got these very well-informed, very confident nurses identifying negative changes in their patients sooner. And that's resulting in quicker rescues and lower mortality rates. All of that is great stuff, but how do we get there when we've got barriers to face? Financial ones, time, fear, lack of motivation. Financial barriers, testing fees are really quite expensive. So we've got PCPS 008, which is our Houston Methodist policy, which covers our certification payments. And you may be aware that certain organizations are arranging for prepayment of tests, so it's nothing out of pocket to you. Yet others of you may be wondering why that didn't work for you. So I'll share with you that the certifying bodies, they develop the programs that let employers make arrangements like that. And a couple of the big ones are not quite on board yet. So if the certification that you want is not available by prepayment, the hospital will cover that certification. Now, recertification is still an area of opportunity here. Only 31% of hospitals cover certification fees to begin with, and even fewer cover recertification. That's the boat that we're in. And I understand that with a fee of $250 to $400 to maintain your certification, that's a huge chunk. I just want to commend you for taking responsibility for that, and thank you on behalf of this profession for maintaining your certification. Another huge barrier that affects so many is fear or anxiety, and it could be fear of failure, really is so prevalent. Fear can disable you. Fear can dominate you, dissuade you from changing your path when you're on to making a change. To that, I would just say, think of all the things that you have done, all the things you've become after first overcoming some fear in the past. Certification is a drop in the bucket compared to all those other things you've done, and it's doable, so we have to push through. Motivation is can be a variety of things, and it's really a lack of motivation here that we're talking about as a barrier. But, what can we do but point out what there is available if you'll get it done. I read an interesting survey which showed that they surveyed nurse leaders and they asked them why their nurses got certified. And they also asked the nurses why they actually got certified. And 71% said they did it for some internal reason. Only 40% of the leaders got that right about their nurses. The internal reasons are huge, those intrinsic factors. However, we still have clinical letters, reimbursements, recognition, ceremonies, cake, poultries, plaques, badge hangers, because they are all best practices. They are best practices because they show up on the list of motivators for nurses. And the absence of them definitely shows up on the list of demotivators. In this slide, or prior to this slide, I was going to talk to med-surg nurses about test-taking tips and show them some sample questions from the med-surg nursing boards I don't need to do that with you. So instead, I'll take you here to my closing slide. With this slide, I was going to tell them that I was hoping to congratulate them soon about having accomplished certification. But with you, I'm going to use it to pose a challenge to you that you be the one celebrating with someone else. Please consider in the next year becoming a mentor to someone and walking them through the process of certification. Talk to them about the benefits that you know. Tell them about how it has changed your practice or the practice of people that you know. Ask them what their barriers are. Help them address them, because whether it's fear or financial or lack of motivation, you have overcome it yourself. And who better to walk with them on that? If you do this, then next year this room is going to be even more full. And there's going to be a lot of positivity going around. Thank you for taking the time to listen. I'll see you out there.